Well, welcome everybody to the wild story of disease and humans. We're always trying to stay one step ahead of diseases, and our very existence depends on our ability to fight these diseases. So, disease and humanity have a very crazy relationship. First of all, we want to understand that diseases of different types have a different occurrence rate across time for humans. Some diseases are increasing in their occurrence. These include diseases that happen later in life because today our life expectancy is longer than previous generations. So examples of these types of diseases are Alzheimer's disease and cancers, which occur more often later in life. Of course, there are cancers that happen early and can happen very young in life, but most cancers across the broad spectrum of humanity occur later in life. So we call these chronic diseases. These are diseases that happen for a long span of time and happen oftentimes later in life, but they can be fatal diseases oftentimes. Other diseases are decreasing in occurrence because advances in sanitation and medication have allowed us to control their prevalence and harmful effects. These examples include measles, tuberculosis, and HIV. Medical advances and things like immunizations have allowed us to control these diseases. If we lived just 100 years ago, our primary concern would not be cancer. Our primary concern would be surviving measles. But since there was a measles shot, it came out and still is out protecting our society, we're not getting measles. So now our focus medically turns to the diseases that happen because we've survived now measles and things that would kill thousands and thousands and thousands of people younger than their bodies would even encounter cancers later on in life. So many of these diseases are called communicable diseases. These are diseases that are passed from one person to another. Things like cancer can't be passed from one person to another, but there are cases where viruses can be passed from one person to another that do have an occurrence later on in life of producing cancers. So it can get kind of confusing, but if you generally think of chronic diseases, diseases that happen later in life and for a long span of time, and communicable diseases as diseases that come about due to infection from person to person, you can kind of have them categorized well in your mind. But you and I all know that this is very much the case. There are exceptions to the general rule that communicable diseases don't affect as many deaths as chronic diseases. And those are emerging infections. Examples that we've had recently are the H1N1 virus, the West Nile virus, and COVID-19. And E. coli is a bacteria that is oftentimes pops up in foods that haven't been cleaned properly. So novel or new viruses that pop up introduce challenges to our health because humans have not faced them before. They're different from any virus that's ever come about. So they spread around while we try and figure out ways to fight them. And our example with COVID-19 is very prescient because we're trying to figure out a vaccine now to treat it, and as well as therapeutic medications to treat the symptoms of COVID-19 to try and curb the death toll on that virus. So there again, I talk about E. coli as a bacteria that pops up. So what helps us? Living conditions and sanitation. In America, we are very fortunate, most places in America, to have a higher level of cleanliness and good sanitation departments that take care of our trash and our sewage. There are certainly places across the world and even in America where these conditions aren't the best, and oftentimes disease is a result. Preventative measures such as immunizations are key to helping us stay healthy as a society. I used the measles example before, but there are a huge number of immunizations that people receive that build a tolerance or an immunity within our system for some of the world's most terrible diseases that have ravaged the world, killing off massive numbers of populations in the past. Now we don't have to worry about them because immunizations have allowed us to move past them. Accessibility to medical treatment. When you get sick, the very fact that you can go see a doctor or a nurse is a real advance in humanity. So being able to see medical treatment before maybe something gets bad or worse is key to an outcome of health. And lastly, heredity. We're able to understand our heredity a lot better, medically speaking. So there are tests that allow us to see things that might become a problem down the line for folks. And we also understand that if, say, my dad had a heart attack because he has heart disease, then I know from a very young age that I need to be in contact with my doctor and say, hey, doc, I want you to know my dad had heart disease and I'd like to keep an eye on that. And the doctor can then run tests to make sure that if I'm at a higher likelihood of contracting heart disease, then I can be monitored for that and maybe put on a cholesterol medication or something like that to help curb the effects ahead of time. So our understanding of heredity is important. So life's all about choices. Over the last decades, fewer Americans are dying of infectious diseases and more die from chronic illness, as we talked about. Life expectancy, that's how long we can kind of expect to live on average as a society, can be improved by practicing primary prevention. That means we have to choose health enhancing or bettering our health lifestyle behaviors. That's kind of the good news, is our health is more in our hands today than it ever was before. Because before, we had to worry about just walking around and then contracting a horrible disease and it potentially killing us. Now, we can expect to live much longer. So we have choices we have to make to give that longer life a better chance of healthy life. Okay, so here are the important lifestyle behaviors that significantly reduce the risk for illness and premature death. First, avoiding tobacco and vaping. Throwing a bunch of smoke and chemicals into your lungs is not a good idea. That's a war tactic. We don't want to do that to our own bodies. Second, avoiding alcohol and drugs. Avoiding these things, whether the drugs are illegal drugs or if they're prescription drugs that have been prescribed for someone else. Avoiding alcohol and drugs is very important because it also curbs our impulsive decision making. That's decisions that we make on the fly when we're feeling like nothing bad can happen to us. Avoiding alcohol and drugs that cause impulsive decision making can really help our life expectancy. Eating nutritiously and managing a healthy weight. We know that healthy weight relates later on in life to a healthy heart and less of a chance of developing a number of cancers. So feeding our body well, managing a good healthy weight is important. Avoiding violent situations. Sometimes people get caught up in a situation that is 2 seconds long, but 50 years in a nursing home as a result. So avoiding violent situations, learning how to de-escalate, learning how to manage our own emotions and behaviors. Very important. Participate in regular fitness activities. That goes hand in hand with managing a healthy weight, but also a mental health aspect to it. We know that fit bodies create fit minds, and fit minds create healthy minds over a long, long lifetime. Seeking help for depression or other mental disorders, whether it's your own or within your family or the people you're living with. Getting help from professionals is very important in managing mental disorders and depression. These are chronic illnesses, just like a physical illness that lasts our whole life, like arthritis or something like that. Depression and mental disorders are medical issues that are very common across the population and are things that really need assistance from a medical provider. So whether it's you or your family members, you're dealing with it. So you need to have that support system with you. Wearing seatbelts in a car and helmets on bikes and skateboards. Again, practicing healthy behaviors over and over and over, but make them healthy habits. Healthy habits are there because when you need them, you can fall back on them and they'll protect you. Very literally, helmets and seatbelts are those fallbacks. Thankfully, we don't have car wrecks every day, but when they do happen, and they do happen every day, if you're wearing a seatbelt, you have a much, much higher chance of surviving a car wreck. Foster healthy, rewarding friendships and relationships. Over the course of a long life, it's really helpful to have partners in that life that can walk with you in a healthy manner, that can affirm you, help correct anything that needs correction in an honest fashion to help you live the best long life you can. All right, so making individual decisions about health behaviors positively or negatively affects health status more than heredity or environment. That is something that we have not been able to say as a human species ever until just recent generations. So make those decisions for yourself, encourage positive decisions for your friends, and that's the best table setting we can make for a long, healthy life. Thanks for listening.